The state Maryland average was anywhere from 29.4, and there were no national standards that we could compare this group to. In response to having been in a physical altercation, 51.98% of the children reported yes to being involved in a physical altercation within the last school year. In response to bullying on school property, 45.71% reported that they had had a bullying type of interaction in the school system. And more importantly, and this has been a new topic recently in the media, 23.75% reported that they had been electronically bullied. So the state average is about 19.4, so we're slightly above the state average on that. Mental health, like it was identified in the high school population, was identified as an issue for the middle school population also. 22.76% reported having had serious thoughts about killing themselves. 14.79% had a plan to actually carry that out. On the high-risk behavior side in the middle school age population, question 36 identified that 11.76% of the middle school children have had sexual intercourse, and 50% of that 11.6 had actually had more than one partner. And more importantly, in the middle school population, 45.71% of the children that were sexually active reported not having used any kind of intervention to prevent underage pregnancy. Weight management was the third finding in the middle school population, where 24.77% reported that they were slightly overweight or very overweight, and 43.9% said that they were trying to lose weight. 22.98% said that they had gone without eating for more than 24 hours in an attempt to lose weight, and 5.35% identified having used powders, diet pills, or a weight program that a doctor had prescribed them. And 6.09% reported taking laxatives or actually vomiting to control their weight or keeping from gaining weight. That was the overall responses in the middle school population. When we conducted the survey of the 460 plus parents, they identified that the most common illness in their children were colds, fevers, that was at 58%, sore throats, and headaches. Those were the three most common illnesses. That equates to the findings that we're seeing in our database from our school nurse health suites that identifies over 1,000 children seek the school nurse support daily in our Washington County public school systems. And when you equate that to the numbers we see in our reports, that is closely tied in. The other striking finding that was identified in the parents' survey is when they were asked about why they do or why they don't seek health care. The reasons they gave for not seeking health care was that it costs too much, they can't take time off from work, and it's hard to get an appointment. Those were very interesting findings for our health system because those are the things that we try to mitigate. So we'll be working hard with Washington County Public School Systems to try to improve that. When they do need help, they do use the family doctor or clinic. 95% of them identified that they are going to the doctor, but only 83% reported that they had had their child examined within the last year. So that might be sounding like a good statistic, but we would like to see every child at least evaluated annually for screening purposes. The parents did identify that 69.58% felt that the school wellness centers was a welcome health service and that they'd like to see that continue. Now, in comparison to the survey findings, the parents also identified that the three top concerns they have for their children as far as health issues are behavioral issues, mental health issues, and weight. So they did identify the same findings as the survey, but the high-risk behaviors and that high-risk sexual activities was not on their radar. So that concludes the major findings from the research study conducted in 2004. The intervention work that we believe is necessary, one, certainly partnering with our community partners and Washington County Public School Systems, the mental health issues identified in depression, high-risk suicidal ideation. The screening for those children should be something we should be closely working on. Second, nutritional services for the children in school services, although very robust, needs to continue to try to promote healthy eating, healthy weight loss, and healthy weight maintenance so that we can continue to mitigate the risks of obesity and the swings in the weight our children are experiencing and the pressures that are experiencing. The high-risk behaviors identified in our survey related to the sexual activity, the bullying, the physical violence, those are things that require interventions, and we hope to continue to work closely with the Washington County Public School Systems to do those interventions. The discussions about all these have begun. Not only is this session important for the board members and the community to be aware of the findings, there was a session 3 weeks ago, where community partners from Washington County got together to address health concerns in our younger age populations, and there were several great recommendations that came out of that work. I am not going to represent their work today, but I think that there's a great opportunity for Washington County Public School Systems, community partners, Emeritus Medical Center to continue to work together to improve the health and wellness of our children in our community. I also am aware that the state of Maryland is also going to conduct this survey again, and Dr. Wilcox could probably give you more information about that, because one of the recommendations is that this is just one research study. You can't really make too many tremendous changes based on one research study. It really should be corroborated by another research study. So having the state do a similar study will also support the work that we need to do together moving forward. So at this point, I'll stop and take any questions and answers. I know you've had a long day, and I don't want to keep you here.
Thank you, Dr.
extremely
Sapiro.
long.
Questions, comments, thoughts?
Probably need to address this as quick as possible.
Okay.
Thank you for the presentation, all the time that you spent obviously going through all this and taking the time to come and share it with us. What kinds of things are other communities doing that have some of these similar challenges, whether it's the community or, I mean, the school's part of the community, but what things are other communities doing through the schools that are trying to address some of these issues? What things are other communities doing outside the schools, and how can we sort of think about what we can learn from what others are doing?
Okay, I'm aware in the state of Maryland, Howard County school systems are closely working with their mental health providers in their community because their findings were very similar to the findings I reported on the mental health issues. And in Howard County, there's a resource issue that they are working with their community support groups with, so that they could get the children screened, and then once you identify children at high risk, then the support that they need for evaluation and then maintenance is being worked on. In the Philadelphia school system that is also partnered with Children's Hospital of Philadelphia to run their health suites, they're doing innovative work with screening, as well as partnering with the school systems on educational programs. Those educational programs relate around the high-risk behaviors of the sexual activity. They actually distribute condoms in the health suites. They also do sexual prevention education, where right now most of the school systems around the state and mostly around the country are doing just abstinence education. So I do believe that there's a role for us to consider that intervention. The community partners related to healthy eating have really stepped up and are willing to work within our community to do more programs on healthy eating and healthy weight loss work and planning and education. So I do believe that those are good things. And I do believe that Washington County Public School Systems has a great program on bullying. I think that we may need to really address the cyberbullying that was identified in the study a little bit more aggressively. And I don't know of any community that is really actively working on that that's been successful. So that is an opportunity for us to research and partner together to see how we could mitigate that risk of cyberbullying.
Are there, I'm thinking back to our previous conversation as a board about being sort of innovators and on the leading edge of solving problems. I don't know if there are other counties in the state that have followed our model with providing health services and school nurses, the one that we've pursued with Meritus. If there are others, there aren't many others.
No, there are.
So it seems to me that synergy with now 2 years of that experience working, 2.5 years of that experience working together between our organizations, and I don't know what this would look like, I'm not a healthcare professional, but it seems to me there's an opportunity to build on that foundation, which is unique to Washington County, to perhaps be innovative in the way we address some of these issues as a school system combined with a health care system.
I totally agree with you. And one of the most easy way to facilitate that is through Dr. Wilcox and his staff, which we found very easy to work with, very engaged, very willing to hear the results and work with community partners and us on what the next steps are. Dr. Wilcox attended that session 3 weeks ago, so he heard it firsthand on how ready the community is, ready to rally around these issues and move forward with them. But if we see health issues as so important, because if we don't make interventions and intervene now while the children are growing, then they become unhealthy adults. So really this is a long-term intervention that, working with public schools, we could really make a difference, not only just in Washington County, across Maryland, and maybe even nationally. So as far as I know, the only two big programs are the ones that are managing the school system in Philadelphia through CHOP, and Washington, D.C. has also partnered with Children's National Medical Center to do some similar work, and then Meritus and Washington County Public School System. So we are not just innovators, we're actually leading how we could transform health and wellness in our schools to create future healthy populations.
Yes.
Do we, and this is, I guess, more toward Dr. Wilcox, have we picked up anything with, I think it's the National Football League, that has the 60 minutes of activity for kids every day? Have we been looking into doing anything with that? Because I know we cut back on recesses a few years ago, and apparently that's not really a very good thing to do. So I'm wondering if we are picking any of that back up.
Well, we do have several schools that have engaged with Play 60, which is the NFL piece. As recently as, 3 months ago now, HEAL, which is Healthy Eating Active Lifestyles, which is a new 50C3 C3 Foundation that was put together by Dr. Katari and a number of other docs from Meritus. I sit on the board. They had arranged to have some NFL players from the Ravens come down and kind of kick it off within our community, but once fans of the Ravens found out that they were coming, there was such concern put up by the sheriff's office and local police that we couldn't handle the crowds, that we backed away and we're going to do it again. That's all to say that, yes, Play 60 is something that HEAL, as well as other organizations, are bringing to our young people. I would just say a couple of other things. We have probably one of the most unique data sets in the United States right now, and that is we have every clinic visit or every medical health office visit, and for what purpose, that's now been tracked by Meritus through a program that they brought to us called SNAP. I actually take a look on a monthly basis at how many incidents we've seen and for what purposes. We can start to harvest some of that data and then target some of our instruction to help young people and help their families. But we have been slow to do that because you start to get into privacy rights and all kinds of other issues. But we have a health advisory committee that's meeting again in 2 weeks, maybe next week.
No, I think it's tomorrow.
Tomorrow. Time flies when you're having fun. And that, that sheet's in my daily packet because one of the things I want to begin asking is, what are we doing for some of our young people who have diabetes? What are we doing? And we, as many of you know, early in September we had a diabetic advocacy group that was here working with all of our administrators. Janice and others were particularly important in making that happen for us. So we're doing some things. That data set, I think, is going to be powerful. It will inform our education programs. It will lead us to say that we perhaps need to reestablish recess as a primary element of play in some of our schools because the physical fitness of our kids will have long-term benefits beyond that. There are a couple of other things that I would want to make you aware of. When you come back to school in January, I believe one of the things that we're going to do is be one of the first school districts, at least in Maryland, who will have on every, time's up. He said I took too much of his time. Who will have on our menus the calorie loads of the individual portions that young people will get. Those same calories will be reported out in our building here at the CES building, so that you'll know when you take a tuna sandwich how many calories are in it, if it's on a croissant versus whole wheat bread versus whatever other modicum they put the tuna on. So again, I would simply say we're poised to do some good things. This was really an eye-opener for some of us. Carol and her team have had these kinds of surveys from the State Department for a number of years now, and she's been tracking this over time. Her expertise, she was actually the primary leader in the conversation 2 weeks ago when all the healthcare providers came. She spoke on behalf of the district there. So I think we're in a good place. The last thing I would say is we are addressing the issues of cyberbullying. One of the things that we're seeing right now with some of our Campus Sentinel efforts is that we can see when kids are picking on other kids if they've not locked down their geolocation codes. We've noticed a number of kids who do things inappropriately using Tumblr. And one of the things that kind of flew through this area, we don't hear too much of it right now, was a non-geocoded technology, so we didn't see this through Social Sentinel, but a technology called Yik Yak that kids just use just to beat each other up, and it would be on for about 7 or 8 seconds, and then it was gone, but they would call each other horrific names, and people would just pile on through Yik Yak. So, we do see that, and we are working on that as well.
Dr. Sapir, just to follow up, and please correct me if my thinking is faulty, but I don't feel any of these issues happen in isolation from each other. It occurs that they would be more co-occurring, and so if you have a drug problem, you may have a promiscuity problem, you may have problems at school. I mean, it seems like they're all wrapped around each other. What would you say, in your opinion, is the root cause, the core cause of this? Is of all of these, would mental health be the pivot point? What self-esteem with the mental health and behavior that would cause everything else? You see where I'm going here?
That's a really, really good question. I really do believe that. I think you've answered your question. I think it starts with the mental ability to manage their daily lives and then their daily stressors, and then as well as all the socioeconomic factors that each of the children bring every day to their schools that leads to the behaviors as well as the at-risk behaviors, and then to the point where the violence or, happens. So I really do believe that screening and identifying those children at risk that are not managing and coping well or having the coping skills they need to survive in this complex world we live in today is kind of where the root issues are occurring and what we need to really work on together.
And my concern is mental health services are tough. There aren't too many in the county for the young children, and the earlier they're identified, I think the better the intervention has of working. I know Brook Lane is doing expanding their beds right now, but I'm not sure they even have the capacity to handle what we're talking about
Well,
here.
for the education of our board, Brook Lane is a really good partner in our community and has been working closely with Meritus Health, and we were able to work with them and get mental health screeners to be in our wellness centers. They just received a $25,000 grant to do some screenings and do some interventions in the 2 wellness centers that Meritus runs in our school systems, but is that enough? So your
That's-
question is
yes.
right on
In
target.
other words, if we have a limited pot of money, where would we get best,
Correct.
the
So
wider
so
service or
I
help
would
for
say
those dollars?
certainly a big target of opportunity, and then once those children are identified, getting them screening services and then intervention services is probably the next steps. So, and those need support. We don't clearly have enough child or adolescent mental health resources in our community, but we're actually a lot better off than a lot of other communities. So that's one of the big deficiencies in Howard County, where they have enough mental health providers, but for the uninsured or underinsured people, those providers can't access those mental health screeners. So here we have less of that issue, but we just need more of those mental health
Health
resources.
services.
I think, I really, this was very eye-opening when I was reading it the last couple of nights. And I think what Donna said really was so spot on, because you can see where the interaction, the connection is between a lot of these activities. A child that's not a young adolescent, let's say, who's not getting the type of attention that they crave, is going to find a way to get it. And then more often than not, it's going to be something that would be detrimental to their health. If you're not getting the attention you need at home, you can find a boy or a girl who's willing to give that to you. If you're getting bullied, you're going to try to find something that eliminates that from you. So, the mental health, I think, is huge, and self-esteem. And I'm not saying, give everybody a trophy so they feel good about themselves. I'm thinking, we have to teach kids to understand how to feel good about themselves. When you talk about weight loss, it's one thing to tell them, okay, watch how many calories you eat, but there's more to it than that. And I'm a classic example of that, because depending on what I want to eat that month, is going to determine how big I get over a course of time. But I've learned recently, it took 60-some years to do it, but I've learned recently, it's really interesting to read what you're putting in your mouth. And if you read the label on something and you see 17 items that you have no clue what they are, the odds are it's not very good for you. Found out Subway had, what was it, some kind of styrofoam or something in their bread, some ridiculous component that, for their sub rolls, to keep them fresh a little longer and whatever they wanted from them. They've stopped taking it out now. But, there has to be some education. There has to be some mental health support. I think, we've got to work somehow with parents, too, so that they understand, some of them understand the issues that teenagers are facing. We faced the schoolyard bully when we were growing up. We didn't face the one that had no face. The one that could just put his name on social media or whatever the case might be and just make you feel like crap. And I really think we've got to find a way, not just us, but society as a whole, to support these kids in positive ways. So This was good information. Thank you very much.
Thank you.
for
I'm
that.
really encouraged to see how much engaged the board is, and it seems like you're really concerned as we are. And we want to continue to work with you to try to do whatever interventions we can to address these issues.
And to Mr. Gesford's comment, what kind of timeline are we, in the best possible scenario, Dr. Wilcox, do you see some proposal or something coming back to the board?
I would know more in the next couple of weeks as we meet with our partners from Meritus. You should know that our meeting tomorrow is not just with us and Meritus, but we are once again re-engaged with the health department in a meaningful way. So we'll see how that conversation goes. Mr. Stoner and some of his team will be here with us tomorrow to have this conversation. We'll try to formulate some recommendations and bring some things back to you. There is some low-hanging fruit that I think I can probably bring back in a February, March timeframe, if not sooner. But as I said, some things are already happening. For example, the calorie counts and things, they're happening Monday irrespective of what the board decides to do, because we think it's right to let our kids make informed decisions around the lunchroom. They need to know what their choices mean when they go through the lunch line. And that goes towards building a healthier adult through childhood. If you are looking at calorie counts consciously when you're a young kid, you're more than likely to do it when you're older. A couple other things, for 3 years now, I have said to our administrators, we want to catch kids being good. Well, that goes to their mental health state. Why would we continue to beat kids up for things? We talk internally a lot about having an asset orientation as opposed to a deficit orientation. That means that, when you come into my classroom, I'm going to try to find something positive to say to you rather than say, you don't have your homework again, do you? We're going to say, hey, we understand you had a challenging night last night. Tell us about it. We want to learn from you. So I think there are a number of things that are happening, but my sense is perhaps we can aim towards more of a comprehensive thing on the mental health issues, because there's some community sensitivities that we have to be aware of there. When you start talking to kids about their mental health, parents want to be engaged in that conversation as well.
Understood.
So that's probably a little longer term, but in the short term, I think we can come back with a lot of things on the risky behaviors. I think we can come back with a lot of things relative to the weight management, overweight.
Any further, Ms. Williams?
Yes, I wanted, you mentioned the risky behaviors, and we're talking about Philadelphia and what they're doing with their sexual prevention education within their school system. When was the last time we looked at our family life program? Have we done anything curriculum audit-wise? No.
Carol or Rick,
Is that
up
something
to
in
a
a,
microphone though, just to say it, and then.
I don't personally supervise that, but I was a family life teacher for
and I remember that we did have a presentation to the board not so very long ago about that. But what I don't recall is if there were recommendations made to actually change the curriculum to address some of these
It
things.
used to come
that-
before curriculum and instruction, and then would come before the full board as a program of studies, and I'm not sure when that last happened. Mrs. Harshman, as curriculum chair, do you recall?
Haven't seen anything of it since I've been chair, what we're doing on
Okay.
that.
Let us look.
If anything changed, right?
Thank you.
Just wondering also with regard to the elementary guidance curriculum, similar things, are these kinds of topics a part of that currently? And is there the possibility or the need to
We're going through
expand or to key in on things?
as part of my goals for this year, we're going through a comprehensive review of our guidance program as we speak. I believe they've met 2 or 3 times this year. I've met with Dr. Domain and with our new guidance leader, Robin Handler. They're looking at guidance services top to bottom.
And I know they've had Robin put out a survey, so, thank you.
Anyone else? We're getting ready to close the work session. All right, thank you very much again for the information and your time.
Thank you.
So we're meeting
Thing with, it's so tied to socioeconomics.